a health plan, or a massive tax cut? The Senate reveals their proposal to replace Obamacare. A San Diego company takes a big step forward this week toward making algae a viable fuel source. And are traffic deaths preventable? We check in on a San Diego program that says yes. I'm Mark Sauer. The KPBS Roundtable starts now. Welcome to our discussion of the week's top stories. I'm Mark Sauer, and joining me at the roundtable today are KPBS health reporter Kenny Goldberg. Hi, Kenny.
Hey, Mark.
Good to have you back. Reporter David Wagner, who covers science and technology for KPBS. Hi, David.
Good to be here.
And KPBS Metro reporter Andrew Bowen. Hi, Andrew.
Hey, Mark.
Glad you're here today. Well, the Republican secret bill to repeal the Affordable Care Act, finally exposed to scrutiny on Thursday, looks a lot like the wildly unpopular House version. Here's Senate Majority Leader Mitch McConnell.
Because Obamacare isn't working by nearly any measure, it has failed, and no amount of 11th hour reality denying or buck passing by Democrats is going to change the fact that more Americans are going to get hurt unless we do something.
Senate Republicans promised a top-down revamp of the House bill that narrowly passed last month. Its bill figures to eliminate health insurance for millions of Americans and gut Medicaid over time, while providing hundreds of billions in tax breaks for the wealthy. Democrats vow a fierce fight. Some Republican senators are waffling, and even Donald Trump has called the GOP's House plan, repeal, replace, mean. Can you start with the basic changes here, the high points of this plan to scuttle Obamacare?
Well, first of all, the whole effort is based on a false premise. And the false premise is that Obamacare is collapsing and that if Republicans don't step in, it's just going to be dissolved. That's just not true. For example, California's Obamacare market is flourishing. There are other states where they're doing fine. That's number one. Number two, as you said, to fabricate an entire health care reform plan based around the concept of cutting health care to the poor, the disabled, in exchange for giving tax cuts to the rich. I don't even understand what they're trying to do.
Mm-hmm. So, I mean, and some critics here and Democrats have pointed out we shouldn't call this even a health care plan. We should call it, some sort of tax reform plan and a shifting of tax responsibility.
That's right. I think it's window dressing, the health care thing. But to the extent that you could take it at face value, the Senate plan is even more severe than the House plan in that it makes deeper cuts to the Medicaid program, although it doesn't start until 2020. Mm-hmm. And it allows states to waive some of the Obamacare requirements that they have to provide, for example, maternity care and preventive care. It allows states to waive those requirements. So if that were to pass, presumably insurance companies could sell these junk insurance plans that just don't have that many benefits.
Mm-hmm. So the cost would be relatively low, but the coverage is going to be...
Sure, you're going to have low premiums, a high deductible, and if you get sick, well, maybe your thing will be covered, maybe it won't. If you're a woman, you won't have maternity care, and you have to pay extra for that. I mean, we've already had these kind of fights in California and settled them, but the federal government, under this plan, would enter into this stuff all over again in all the states.
Now, let's give us an idea of the impact of this. We're talking about a sixth of the U.S. economy, and a lot of Americans are served by Medicaid here.
Absolutely. And in California, we've expanded Medi-Cal to the extent that about 13 million Californians have Medi-Cal now. That's 1 out of 3 people in the state. Mm-hmm. So if the federal government were to severely curtail federal funding for Medi-Cal, it would have an enormous impact in California. In San Diego, for example, we have more than 900,000 people that now have Medi-Cal coverage here. That's, 1 out of 3, 1 out of 4 mm-hmm. residents in San Diego alone. Mm-hmm. In some counties in California, there's an even higher percentage of residents that are on Medi-Cal. So this would have, I think, a devastating effect in California, and not only on the Medi-Cal situation, but on people on covered California, because they're talking about reducing some of the federal assistance for people that get a Obamacare plan.
Through the state exchange.
That's right.
So what is it that makes a successful state exchange? You said that California's, covered California is thriving, and there are other states that, some states don't have them, they just rely on the federal exchange to do it for them. But what is not working in those states where the exchanges are kind of collapsing?
That's a good question. I mean, some of these states, they did not take the federal offer to expand their Medicaid program.
Right.
So as a result, there's a lot more pressure and a lot more people uninsured. Number two, you've got a lot of large health insurers pulling out of some of these states, Ohio and Indiana this week alone. And I think it's because the federal government has been basically undermining Obamacare since the Trump administration took power. They've been sending mixed messages out about it. They were talking about, even before this bill was pushed through, or introduced, that is, they were talking about, well, we may enforce the mandate, we may not, we may penalize people who don't get insurance, we may not. So they've been sending mixed messages about this thing all the time.
So some of it is just the uncertainty about whether or not Obamacare is going to survive, and the insurance providers are unwilling to take a step into that, into the exchanges, if they're not sure that they're going to even be there.
That's right. And insurance companies, they want to make money. That's their business. And so they're not going to jump into these states where the future seems murky. They'd just rather not even deal with it.
Now, in both the House and in the Senate, the process itself was heavily criticized by Democrats and other critics. Now, in the House, it was that they had gone ahead and passed this bill before it was even scored by the nonpartisan Congressional Budget Office. And what was the complaint over the Senate and how they pulled this thing together?
The complaint was that it was drawn up by, 12 or 15 senators in secret, behind closed doors.
All men, right?
All men, no women on that panel, which is huge. Yeah.
Mm-hmm. And there was no outside input. There was no input from any kind of stakeholder groups, the hospital association, doctors, patient groups. No input at all from anyone.
Hearings with experts, that sort of thing.
Right. And it was not an open process by any stretch of the imagination. Their argument for doing that is, okay, well, now we've introduced this bill and we're going to listen to all the amendments and all the input at this point. But that's not quite the same thing.
I wanted to turn it back to California for a moment. While all of this was happening, the state Senate here, not for the first time, passed a single-payer health bill for California. In other words, we would kind of set up our own version of a single-payer government-sponsored plan to cover everybody. It's now in the Assembly. Tell us a little more about that and how likely it is that it might actually pass in California, what it would cost.
Well, the single-payer idea in California has been floating around for some time. The legislature actually passed a version of that when Schwarzenegger was governor, and he vetoed it, and that was the end of it. But under this plan, people in California, there would be no more Medicare, no more Medicaid, no more private insurance. It would all be this one big state-run program where everybody could get whatever health care they needed, their prescription drugs. Any resident of California, I don't even think you'd have to be a citizen. The problem is, in the Senate bill, there was no financing for it. So they just passed it with the concept, but without the nuts and bolts. Basically, to make the thing happen, they're going to have to come up with, I think, about $300 or $400 billion.
It's almost $400 billion. Yeah.
Right. And the only way to do that is to raise payroll taxes and raise sales taxes.
And they're assuming they're going to get all the federal money from Medicaid and
That's an excellent point, because to dissolve Medicare and switch it into this other thing in Medicaid, they would have to get a federal waiver. I think that's highly unlikely that they'd get one.
Mm-hmm. Now, getting back to the Republican plan here to get rid of Obamacare, the opioid epidemic has been in the news lately. There have been some tragic stories about shocking numbers of deaths, people addicted, the cost of this. But this bill, it looks like it would go to the heart of taking away money from these various programs that help these people.
That's right, and that's just one example of some of the cuts and some of the effects of the cuts. And I think it's important to point out that I don't think there's any interest group, trade group, patient advocacy group that I've seen that supported it at all. Nobody supports this thing.
David?
It's just been interesting to now see both parties have a crack at healthcare reform. Obamacare was always designed to be a compromise solution, right? It was driving toward universal coverage, but it was premised on a right-wing idea, which is mandating that people buy healthcare, mandating individuals
and keeping
to buy
the insurance
healthcare.
middleman. Yeah.
Now the Republicans are in control. They're not interested in a compromise solution at all, and we've seen what changes they have made. It's to appease their most staunchly conservative members in Congress. So I'm wondering if the effects of this, broadening the single-payer discussion outside of California, if this is going to cause Democrats to also give up the ghost on compromise and start pushing for what their base wants, which is single-payer.
That's a very interesting question. There has been a lot of discussion about that Democrats nationally should embrace this idea and sort of bring liberals and millennials into the fold and get them to show up to vote. But you mentioned an interesting thing there about which we haven't talked about, is the Senate plan would eliminate the mandate. People would no longer be required to buy insurance, and they wouldn't be penalized if they didn't have it. Well, that's going to totally foul up the insurance networks, because if only healthy people are insured, that just doesn't work, or only sick people are insured.
Right. So the young and healthy aren't there. Yeah.
You have to have a mix, a payer mix, to make insurance work. Yeah. If they only have people that are going to file claims and sick people, what insurance company would want to be involved with that?
All right, I'm afraid we're out of time in this segment, but we can go on, and this won't be the last bite of the apple on this topic as we move forward and the whole process moves forward. Well, it was heralded as the green bullet, the biotech solution to global warming. Algae, the clean fuel that could wean us off of oil and gasoline while utilizing their vast system of pipelines and pumps. And San Diego was going to be the Houston of algae. That future has yet to materialize, though algae research here dates back more than a decade. But there was a scientific breakthrough that's recently that's again fired the flames of promise for algae. Start with the basics here. Why was algae, which is basically pond scum, David, why is that so promising to researchers and scientists?
So it's promising as an alternative to fossil fuels because you can use things like sunlight, salty water, algae. You can grow this stuff outdoors the idea is in big volumes and produce fats, oils that you could go on to refine into a fuel. And this would be something that's renewable and something that is carbon neutral. It would emit carbon when you combust it, but the algae would absorb that carbon itself. So it would be a kind of closed carbon system. So that's the attractiveness of algae. Now the problem is it economically feasible to scale this up to compete with oil?
Mm-hmm. And it's, as I said in the opening, it's been growing around here for a long time. A lot of scientists have been involved, and a lot of promise, and mayors have said, oh, it's coming, it's going to be great, we're going to be the center of it. But they've never really been able to make it commercially viable.
Right. The science on this dates back to the 70s, so the science of algae biofuel has been around for a while. And here in San Diego, when algae biofuel work really got going here, about a decade ago, I think the assumption was that oil prices were going to keep going up, and algae the cost of algae biofuel is going to slowly creep down, and those curves would eventually overlap, and algae would become competitive with oil.
Then it would take off at that point. Yeah.
That has just not happened. Right. Thanks to things like fracking, oil has stayed cheap, and algae has not become competitive with it. Mm-hmm. So we are dealing with a situation where it's not exactly a scientific problem, really. It's an economic problem.
Mm-hmm. Well, let's talk about science for a moment here. Tell us about the story you did this week on the breakthrough here in San Diego and why it's, again, exciting when we're talking about algae.
Yeah, the basic biology here is moving forward. So I did a story about a local company called Synthetic Genomics. And what they did is they essentially created a new GMO strain of algae that does something that
genetically modified organism.
Right, right.
Thank you for pointing that out.
Yeah.
Listeners.
So they've genetically modified a strain of algae that does something that scientists have been trying to do for a long time. It produces double the amount of oil as a natural strain of algae, but it doesn't slow down the growth. It still grows at a healthy rate comparable to what we see in the natural strain. And more fat, more oil means more energy for fuel.
More bang for your buck. And, and this stuff does grow like crazy. That's one reason it's so promising. Kenny?
What kind of interest have any of the energy companies or oil companies shown in this kind of technology?
Well, this specific work that we're talking about this week is actually supported by ExxonMobil. So Synthetic Genomics is working with one of the world's biggest oil companies on this. And our listeners and viewers might have seen Exxon is actually running a lot of ads on TV lately featuring people in scientists in algae labs. So they're very much highlighting that they're paying for this work.
Is the technology far enough along that we can actually take whatever small amount of algae we are able to produce, or the lipids from that, and power a car or a power plant with it?
Again, scientifically, yes. It's really a question of economics and scale, and also a lot of regulatory hurdles. So these are GMOs. And synthetic genomics, if they want to go ahead and try testing these in large outdoor ponds in a real large-scale farming situation, they're going to have to get permits for that. They're going to, and get the public on board with that. A lot of people have a lot of feelings about GMOs.
But they've done demonstrations showing, driving a car coast to coast, flying an airplane over the ocean,
Right.
fueled by algae fuel, which, as I said, mimics oil and gasoline. That's one reason they like it. We have this huge infrastructure, trillions in pipelines and pumps and all, and we can use it with algae.
Right.
That's why it's so promising. I did want to say Greg Mitchell is a Scripps Institution of Oceanography researcher, has been on this for a long time, and you interviewed him, and he's not terribly optimistic about how soon this might become commercially viable. Let's hear that.
With the president pushing coal and denying climate change, that the urgency is greater than ever. And as much as we can accelerate this, we would like to.
So
that was the wrong bite there. To explain who that was.
We heard the wrong bite there, but that's an interesting bite actually from J. Craig Venter. People might be familiar with him as one of the first people to sequence the human genome. And he co-founded this company, Synthetic Genomics. Mm-hmm. So he's very interested in seeing what genomic tools we can use on algae to get it to be more productive, maybe get it to be economically viable as a biofuel. But yeah, the clip from Greg Mitchell, I think he essentially in the clip we didn't hear was saying, even on an optimistic timeline, this is something 20, 30 years down the line where you're actually going to pull up to the pump and fill up your car with an algae biofuel.
So we'd have to see, and that's very discouraging because for people like you, and I've done stories on this where you dive in and the promise of it, it really is an exciting thing, even for lay journalists who, we all drive cars and we all understand what's going on with global warming and other alternative fuels and how promising this could be. And that timeline it just gets discouraging. It's the wet blanket in the research and the reporting on this.
Usually when I ask people for a timeline, scientists for a timeline of when their technology is going to actually hit the real world, they'll tell me 5 to 10 years. Mm-hmm. Nobody's really saying that.
Nobody's saying that. All right. Well, we'll keep going. I mean, perhaps if there were some crisis, some vast spike in oil, who knows, a terrible international war incident. We don't know, but something's going to have to move to change the commercial aspects of this. All right, we're going to move on. It's been more than a century since Americans first fell in love with the automobile, and car crashes, many of them fatal, is a price we've been willing to pay for the convenience and freedom cars afford. Cars have gotten much safer over the years, and crackdowns on things like drunken driving have reduced accidents and deaths as well. But some believe much more can be done, especially when it comes to street design. Explain this kind of odd name, Vision Zero. What's that all about?
It's a vision of zero traffic deaths. So the San Diego City Council passed its own Vision Zero plan in 2015 with the support of the mayor. The movement started in Sweden back in the 90s, but in recent years it's also spread to a lot of American cities. And it's basically the idea that all traffic deaths are preventable, and we can achieve that goal of zero traffic deaths if we, A, enforce our traffic safety laws, B, educate our public about the safe behaviors that pedestrians and bicyclists and motorists should all be practicing on the road, and C, if we re-engineer our streets to make them safer so that even when crashes do happen, and they will continue to happen, they will not actually kill someone or seriously injure them.
All right, we've got a bite here. Kathleen Ferrier, Policy Communications Director for the National Vision Zero Network. Let's hear her explain it.
But our culture has decided that traffic crashes are part of modern life. We drive, therefore, there will be crashes. The more we drive, the more that there will be crashes. But this is unacceptable. The numbers keep going up. And worse, the people who are getting hit more often and who are getting killed more often are older adults, children, and people of color and living in low-income neighborhoods.
It's an interesting point she makes. I mean, you think of all things that are democratic, it was like anybody can be in a car crash and all, but the statistics bear that out, what she was saying there?
Yeah, absolutely. And it has really to do with equity and infrastructure. So in those neighborhoods in San Diego that have been historically underinvested, or where infrastructure has been decaying over the years and the city hasn't really been keeping up and maintaining it very well, those are the kinds of areas where there's not a whole lot of of these traffic safety and safety designs that are built into the streets. I mean, you think about Bird Rock in La Jolla, there's a system of roundabouts there. It's very safe, it slows down cars, it makes it easier to cross the street because the distance you have to cross is a lot shorter. But in City Heights, southeastern San Diego, the South Bay areas, you still have these very wide lanes of cars that where cars can still drive pretty fast, and still a lot of pedestrian traffic. So those conflicts keep on happening.
So that skews the accident figures to those areas.
In those low-income neighborhoods,
oh,
exactly.
Kenny?
Well, Andrew, if they talk about redesigning streets to make them safer, does the city have the budget for that, given the fact that, I mean, they haven't even fixed potholes for years? I don't know.
Yeah. Well, I mean, the city does have, a multi-billion-dollar budget, and it is investing heavily in infrastructure. What we've seen so far is that the really ambitious projects to redesign streets, with either narrowing the travel lanes or taking some travel lanes out and putting in more crosswalks, widening sidewalks, and putting in these roundabouts, things like that. The really ambitious designs are coming from grant money, not from the city's general fund. So the city has put up some money to improve intersections, create high visibility crosswalks where you have this, bright white paint on the ground that's a lot thicker than more traditional crosswalks, and those can actually have a substantial impact on safety and visibility of pedestrians. But with those bigger designs, the city has not put up a whole lot of its own money. It has been getting a little bit of grant money from the state and from Sandag, but not enough to really make a huge difference in the overall street network.
David?
Something you've been reporting on a lot lately, too, is the city's climate action plan, which has these huge goals of getting many, many more people walking to work and biking to work. It seems like with your reporting here, though, if the city doesn't start really taking traffic safety more seriously, we could end up in this perverse situation where we're succeeding at getting people to take more climate-friendly commutes, but putting them at more danger. Is that something that they're concerned about?
Well, I mean, whether or not we're going to succeed at those mode share goals that are part of the climate action plan, I think is also a big open question, how much the city is really doing to encourage public transit and biking and walking. I think they're part of the goal, or there's a lot of synergy that happens between Vision Zero and the Climate Action Plan, and a lot of times they're put together in the same sentence when advocates and city planners are talking about them. Part of one thing that could help traffic safety, if more people start biking and walking, is just safety in numbers. If you have more bicyclists on the street, that motorists will become more aware that, hey, there are people out there who don't have this protection of a giant metal box around them, and so maybe I should pay closer attention to them. But you're right. If there continue to be a lot of if the number of pedestrians are growing and the bicyclists are growing and nothing changes with street behavior, then that will be a problem, certainly.
Kenny?
Well, I'd be interested to know what percentage of fatal accidents happen on city streets and what percentage happen on highways.
It's about twice as many that happen on city streets per year than on highways, a little bit less than twice as much. I'm talking about the city of San Diego. What I think one of the most interesting points that I found in this reporting, and it might not surprise some people, but it did surprise me, at least when I initially figured it out, was that the number of traffic deaths, when you include highways and city streets together, is more than double the murder rate over the past 5 years.
Yeah, that's a remarkable figure.
It is, and I think that one reason why it might not surprise people is, of course, there are a lot of cars out there. A lot of people are driving. They're driving long distances, and they're all in a hurry to get somewhere. So, the probability of an accident happening is just a whole lot higher than somebody actually getting murdered, because that's a premeditation. But I think there is a question about where we're devoting most of our resources if the goal is to really save lives. Certainly we need to put a big emphasis on public safety in preventing murder and solving murders and preventing violent crime. But I think at least when you look at the numbers, if we want to keep our population safe, you have to think about it holistically and also maybe place a greater emphasis on safety on the streets.
Mm-hmm. Now, has Vision Zero, has it worked in other places or where it's been tried, as you mentioned?
Yeah, well, it's been adopted by about a little more than 24 cities in the United States so far. San Diego, I would say, is maybe one of the later adopters and has been a little bit slower to get going on really serious and ambitious projects. But cities like New York and Seattle have been investing quite a bit in complete streets projects and safer streets and redesigning them. And they have actually already seen a decrease in overall crashes, a decrease in crashes with pedestrians, a decrease in fatalities. So when you invest the money in the right kind of infrastructure, it can actually work. It can save lives, but you have to make that investment.
You've got to have that money. A couple of seconds left. The mayor is behind this. Is it something that people are going to need to get more and more aware of as we move forward?
Well, I think so, yeah. Later this year, we're going to see a public media campaign from the city communications department. The motto is heads up. We'll see how that plays out. But you know, a lot of these solutions are not that everyone wants safer streets. A lot of the solutions are pretty controversial.
All right. Well, we'll see what happens as we move forward. That does wrap up another week of stories at the KPBS Roundtable. I'd like to thank my guests, all from KPBS News, health reporter Kenny Goldberg, science and technology reporter David Wagner, and Metro reporter Andrew Bowen. A reminder, all the stories we discussed today are available on our website, kpbs.org. I'm Mark Sauer. Thanks for joining us today on the Roundtable.